everybody, welcome to your elbow, hand and wrist mobility class. So the reason I'm putting all these three in together because they're all connected, yeah? So the muscles of the forearm are connected to both the elbow and the wrist and the muscles of the hands fascially. So for sure, let's take the forearm flexors at the back of the forearm. When these contract, they are going to flex the wrist. But they not only flex the wrist, they can also pull the hands. We can activate them when we start to claw the ground. So any kind of finger action, so finger flexion like this when we're in a clawing action, if you could do this with me, hold the forearm lightly and start to claw, and you'll feel your wrist flexors here start to activate with your finger flexion as well, yeah? From side to side. And for sure, our extensors on the front of the forearm will not only create wrist extension, but also finger extension. So we're going to work them all together. And this class is good for anyone working with epicondylitis on the elbow, working with wrist pain, could be ligament wrist pain, again, tendinopathy or tendinitis, or just wants to strengthen their hands as well. Okay, so let us start with some controlled articular actions. So just, we can work both hands together. So just wrist flexion and wrist extension. Flexion, extension, flexion, extension, flexion, extension. I take them to neutral, and now you can curl your fingers in and do the same. Flexion, extension, flexion, extension, flexion, extension, flexion, extension, back to neutral. And now starting to make circles with your wrists to create your controlled articular rotations. Nice and slow, feeling into your end range, allowing your circle to be as small as irregular as it needs to be to move outside of your pain body. Pain is when the mind retracts from sensation. And sensation is when the mind-body can stay in connection. You can stay in your felt sense without the mind retracting. And then reversing your circles. And then from here, let's take a wrist stretch. So we'll just start here. And you can pull the fingers back. So as I mentioned, when you pull the fingers, you're also pulling on the wrist, but you're here, you're opening out the wrist flexors. Take a couple more breaths. On the other side. Let's go back to the first side, and this time drop your right ear to your shoulder. And here we are using this as neural flossing to floss the medial, ulnar and radial nerves that move from the side of the neck into the fingers, helping conditions, neuropathic conditions, neuralgia. And then to the other side. Good, and then from here, we'll start to continue that. So just coming to tabletop. And we'll do some extension again. So from here, fingers pointing back towards the knees, and then just bend your elbows back and extend them back up straight. And bend back and straight and back and straight. And as you bend them back, you can claw the fingertips into the ground as well. And extend straight and back and straight. Now from here, if you wish, you can make little circles, or you can rock forward and back. If you wish, you could even come to plank or downward dog. And then back to your knees. And then, keeping your fingers turned back, start to pull your wrists off the ground, weighting the base of your finger knuckles. And then peeling all the way up to the fingertips. And then slowly take your hands back, interlock your hands and just make a few figure of eights, just easing out the wrists. Good, and then from here we will create some wrist extension. So starting with the fingers straight, you can point your fingers in towards each other, palms facing up, and take your hands to the ground, bend your elbows, and then start to extend your arms straight. If some people won't be able to extend them fully straight, your elbows may be bent, so just as straight as you can. Now bend your elbows again, and then start to weight the front of your hand and start to curl your fingers in one by one. And then come into a fist. And from your fist, you can start again, just extend your elbows straight. And then bend down. Extending up. And down. And up. And down. And up. And down. And up and holding for 8, 7, 6, 5, 4, 3, 2, and 1. Sit your bum to your heels, and again, you can just take your hands interlock and just be very gentle and make some figure of 8s. And then from here, you can just grab hold of your left wrist with your right hand and just make circles. So here, your hand will just create a bit of stability through your wrist as you make your circles. And then hold the other wrist. And it can add to the stretch as well. You can slightly drag the skin with your hand in the opposite direction of the movement, just to create a little bit of stretch on the superficial fascia beneath the skin. This is called a vector in physical therapy or neuromuscular therapy. Good. Okay, so now we're going to just go back into flexion extension, and we're going to resist those movements. So we'll start with extension. So you can take your hand into flexion and then take your other hand on top and then push down with your top hand as you flex up and release. We'll do 7 more times, flexing up, push down, release. 3, 4, 5, 6, 7, 8. Other side, pressing down and push up. 1, 2, 3, 4, 5, 6, 7, 8. And then from here, taking your wrist into flexion, press down and extend up. 1, 2, 3, 4, 5, 6, 7, 8. Other side. 1, 2, 3, 4, 5, 6, 7, 8. Now, another thing that you could do if you were wanted to build up the strength in the wrist, especially if there was, let's say, after a ligament sprain or something like that, or even tendon. Both ligament and tendon have to adapt after a trauma. Now you don't want to over-adapt, so you have to build it up slowly. So the rule of thumb is, if there has been a tendon or ligament issue, is that you back off during the inflammation stage and you ice and you rest, and maybe if it's ligament you compress. And then as the inflammation goes down, you start to work your range of motion. So coming back to your movements, so flexion, extension, rotations, and then starting again to just maintain your range of motion as the inflammation goes completely down. And sometimes there's still inflammation deep in the tissue that we can't see it, so there's no swelling anymore, but it's still there. But there may be pain on rotation or on some movements. And then you start to weight bear gradually. So you could have a weight. I'm just going to use my brick today. So usually if there's something, again, like a tendinopathy or a ligament sprain, you don't want to be weighting, like taking a dumbbell and, doing all your rotations and your flexions, like holding, a heavy weight. So you could, I would start off with 1 kg weight. You could use a can of chickpeas or something like that. I'm just going to use my brick today. And you would just start off as, if it's just a new sprain or strain, you would just hold it in an isometric hold, holding for about 60 seconds and release, and then maybe do a little bit of release work, and then come back and hold again, So you could do that 2 or 3 times in one session, and then you could do it twice a day, just to build up strength. What is really, really common, and it's unfortunate, is that someone has a sprain, which is ligament, or strain to the muscles, or tendon, inflammation of the tendon, and they back off and they rice, and they do all that. Rice is the rest, ice, compress, elevate, and they do all that, and then they wake up in the morning and go, oh, it's better, and they go back to their daily things, and then they re-injure. And this is really, really common. So so it's like, oh, well, I can lift this, therefore I can lift something much heavier, but you can't. So it's still healing. So the going back phase is a time where, things can re-injure. And at that point, if you rush that too fast, people can think, oh my God, is this a long-term thing? Because it's not injuring. And so you just have to, it's a fine line. You have to back off enough not to re-injure, but you have to load for the tendons or ligaments to adapt. So that's why isometric holds are good with 1 kg, 2 kg, 3 kg, and then doing small movements. So you could start to bring in some flexion and extension, holding your brick or your chickpeas or your weight, or start to do the resisted ones using your hand as your weight. So these are all the ways you can start to get your tendons and ligaments to adapt after a trauma. And so another great way now to strengthen the muscles of the hands, not only the hands and the forearm, so all the muscles that are here, again, supporting the wrist and the elbows, is finger flicks. So we will do this together. You can take your arms out, hands in line with your shoulders. I like to do 108. It's like spiritual yoga in number in yoga. So go on, we'll stick with 108. So with me, flicking out. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 40. 1, 2, 3, 4, 5, 6, 7, 8, 9, 50. 1, 2, 3, 4, 5, 6, 7, 8, 9, 60. 1, 2, 5, 6, 7, 8, 9, 70. 1, 2, 3, 4, 5, 6, 7, 8, 9, 80. 1, 2, 3, 4, 5, 6, 7, 8, 9, 90. 1, 2, 3, 6, 7, 8, 9, 100. 8, 7, 6, 5, 4, 3, 2, 1. 108. So that is our finger flick mala bead. There's 108 beads on a mala. So yeah, so again, just start to roll your wrists, or just relax, or shake them out. Good. So sometimes I like to do these when I'm driving. I'll hold with one hand and flick, other hand and flick, and just to keep the muscles strong of the fingers, hands, and of the forearms. Okay, so now we're going to start to weight the hands. And when it comes to the elbows, really, I come back to good old chaturanga, yeah? But of course, I'll show modifications today. But in terms of supporting our elbows, we're really here having to keep our biceps strong, yeah? Another thing that I haven't mentioned before is like hypermobility in the elbow. So I might just go through that now. Very, very common, especially in women. I see it in women more than men. But yeah, hypermobility through the elbow joint. And so here it's like, it would be wrong to think that it's a muscle imbalance, because it's really kind of coming from the ligamentous tissue in the elbow. However, a muscle imbalance can contribute to it and make it worse. And so really, it's when the elbow overextends, so it's like too straight. And so really what we're trying to do is create a little bit of flexion in the elbow. So what muscles bend the elbow or flex the elbow? Our biceps, yeah, so the inner arm muscles. So often there can be a lack of strength through the bicep with people who hyperextend. However, you can so the recipe is to build up your bicep strength. However, there can also be people with good bicep strength who still go into a lock. But it is believed that once you have your bicep strength, even if you go into a lock, that your elbow is still being supported by the bicep. Yeah. So either way, you still build up the bicep strength. Okay. So we're going to do chaturanga on the knees, and we'll do just a rep of 10 today. I would really recommend that you start to do these like daily if you're working with an elbow tendinopathy, and that you build up your biceps. So one tool that can really help for people who are just like not able to do these, because they can be really strong for people, is to use these kind of a lovely resistance band like so. So a nice thick materials resistance band. I recommend one that isn't too tight. Some bands you get like there's different strengths, and if the strength is too coarse and it's really strong, you're not going to get this with ease. So I'm using a nice light one. Yes, it gives less support, but something too tight is going to have me like this, and even taking my elbows out here is going to strain my arms. Just taking my hands in place is actually going to create more tension, as in, well, not tension, but from a biotensegrity perspective, but I'm going to have to engage my muscles more. So then it's going to defeat the object, yeah? So for sure, so a nice resistance band. And in our chaturangas, the idea is to tip forward and claw the ground. So it's really important from our tabletop that we claw the ground. So let's meet at tabletop. You can have a belt or not. And stack your shoulders over your wrists. And from here, pull into the navel. Now you want to do this, you don't want your spine to be too domed, and you definitely don't want to be too extended. So when people are weak in chaturanga, usually they're too extended like so, and then it creates what's called shoulder dome. So the shoulders go down and the bum sticks up in the air. And so that's the most common weak chaturanga expression. And so then sometimes people do the opposite as well. Sometimes they compensate, or sometimes just in a different pattern, and are doming as they go in. Now that does make it easier to dome and go in, but just to let you know, over-doming in chaturanga can create impingement through the shoulder. So it's important to protect the shoulder, that you don't over-dome, and then just to get it and to do it properly, that you don't over-arch. So it's all in the balance. So really what we're working with in our chaturangas is quite a neutral scapula position. So you do want to keep the collarbones broad, but to do that, what do we do? What action do we do that to open or broaden the collarbones? We squeeze the scapula together. So when we do that, what happens? The front ribs flare out. So you can keep the front ribs open, but knit your front ribs down and in. So keeping the ribs in, so you're maintaining your core, and then these will open enough. The collarbones will open enough, which is going to protect the acromion process in the glenohumeral joint. So you're not going to be looking at impingement or bursitis from overdoming in your chaturangas. So take your shoulders over your wrists, and again knit your ribs, but keep a little bit of opening through your collarbone. Now again, another common mistake is people do this. So as they drop down, they draw their elbows back towards their knees. Now we don't want to do that because you're going to bypass your bicep strength. So from here, I want you to, even if you have to wear a band, I want you to claw the ground, and from shoulders over wrists, tip forward, shoulders over fingertips, keep clawing. Now keep your elbows where they are, don't bring them back towards your knees, keep them and draw your shoulders forward and then back up. 1, 9 more, dropping down. 2, try and keep your feet on the ground, dropping down. 3, tip forward, claw the ground, drop. 4, tip forward, claw, drop. 5, tip forward, claw, drop. 6, tip forward, claw, drop. 7, forward, drop. 8, forward, drop. 9, forward, drop. And 10. Good. And then you can drop your bum back to your heels, take a child's pose, and just relax. And then when you're ready, you can come to a seat. And we're going to do an exercise that you can do standing up, sitting down, and you have the option of using weights if you wish. So I have 2 kg weights here. And I'm just going to sit in here on a block. You can, once you're sitting with a tall spine or standing up, it's up to you. So you can again use the chickpeas or your bachelor beans or whatever you have. You can progress to wine bottle. It's the best thing to do with a bottle of wine is use it for building up your bicep strength so you don't have to extend into your elbow. Or if you have weights like myself. Now you can also do this with no weight at all. Just do the movements, and this might be good for you just to do the arm movements with no weight, especially if you know you have neck, shoulder, or elbow issues. You may want to back off on the weights and just build up your strength. So meeting in cactus, elbows in line with your shoulders, hands in line with your elbows. And then knit your ribs in, pull into your core. And then from here, inhale the arms up, exhale down. Inhale up, exhale, inhale, exhale, inhale, exhale. 4 more, inhale, exhale, inhale, exhale. 2 more, inhale, exhale, inhale, exhale. So from here, we're going to bring our elbows and wrists together. So inhale, exhale, inhale, exhale, inhale. We're going to 8. This is 3. Inhale and 4. Inhale and 5. Inhale and 6. Inhale and 7. Inhale and 8. Now, if you can with me, inhale up, exhale down, inhale in, exhale out. 1. Up, down, in. 2. Up, down, in. 3. Up, down, in. 4. Up, down, in. 5. Up, down, in. 6. Up, down, in. 7. Last one. Up, down, in. 8, and then slowly release down. Good. You can stay holding your weights here and just start to gently internally rotate and externally rotate. As you externally rotate, squeeze the scapula together, internally rotate, engaging your pecs, allowing your scapula to release. Or you can just do that with no weights. Good, and then from here we'll just do a stretch. Let's take eagle arm, so wrap your left arm over your right. Take the hands together. If you can't take your hands to your palm, you could just grab your thumb. So left arm over right, so you could just take right index to the left thumb, if you wish. And then from here, if you wish, you could make some flexion and extension of your spine, or you could just hold static. And then come to center, and then just drop your right ear to your right shoulder. And then inhale the head slowly up. And change sides. If you wish, making flexion and extension movements in the spine, or just holding static. And again, once again, you can hook your left index around your right thumb. And then coming to a static position, upright, and then dropping your left ear over to your left shoulder. And then slowly release. Good. So as mentioned in the myofascial video on the elbow in relation to like epicondylitis and such, that this can be related to the rotator cuff muscles, the subscapularis, which is the deep internal rotator cuff muscle in the chest at the front of your scapula. Becoming tight and creating this like internal arm rotation and this kind of deep held internal kind of closing action, which can affect the scapular position, the whole shoulder, and which this can create a referral pattern down into the elbow and into the wrist. So what we're really trying to do is strengthen our external rotator. I mean, when we're doing this is external rotation, so holding this and weighting this is going to strengthen them. You could also take your band. Let's do a little bit of band work here. And we will just take the left arm up to center and hold your left arm static. And then take your right arm back and forward and back and forward. We just do 5 today. You'll know if you need this more. You know, at any time you can pause your video and say, oh, actually I need to do more of this. Or just say, you know, really I'm just showing you what to do so you can put it into your home practice. So changing to the other side now. Good, and then we'll go back to the first side. And some people will be able, like me, to keep their hand over the elbow, but some people will be like this. The hand will be coming forward, yeah? And so just take the hand back and down. So external back, internal down. External back, internal. Back and forward and back and forward. Come to the other side. Take the elbow back, allow the hand down. And then take it back, hand back and down. And back and down and back and down. So this is nice and gentle. And of course it depends on the strength of your band as well. But it's really just getting the rotator cuff muscles to do what they're supposed to do without overloading them. But it's still quite strong. And with the resistance band, it'll still help activate the 2B muscle fibers, which are for muscle movement, yeah. And so we want to activate those to strengthen the glenohumeral joint and the rotator cuff. Okay, so you can take your band away. So again, we're going to work on that external shoulder rotation in order to support the humerus position in the shoulder as it articulates down into the elbow. And we're going to do that with a puppy pose, bent elbow puppy pose. So you could take two bricks. I don't have a second one here today. So if you wish to take 2 bricks under your elbows, quite nice. Or like me, you can just take your elbows to the ground and take your hands into a flat fingered prayer. Press your palms firmly together to activate the bicep and the inner line of the arm. And then melt your chest down towards the ground. You can stick your bum out, turning the pelvis up. And here you're starting to open the side ribs tricep area here. And again, this can be quite tight with people who are working with muscle imbalance relating to tendinopathy in the elbow. And then from here, you can dig your elbows firmly into the ground, keep pressing your hands together, and inhale, inhale and exhale, pull into your core, and curl your tail under. And then inhale, melt the chest open and dip down. Exhale, curl in, pull into the core. Inhale, melt and open. Exhale, pull in. Inhale, open. Exhale, pull in. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. And then you can release your bum down to your heels and take your child's pose. Okay, so from here, working with child's pose, chaturanga. So again, it's another strengthening. We're just going to do 5. Again, this is a little bit more kind of bicep pec, so it's not external rotator. So we're just going to do 5. I just like to throw them in. Again, you can take your resistance band. You might need it if you have strength, but you can use a resistance band if you wish. You know, again, if you know that your rotator cuff muscles are weak, I'd resist doing too much of this one because it's just going to over-strengthen the pecs, and it's all about getting the balance between your pecs and your rotator cuff muscles to find the balance we're looking for. So from your child's pose, place your hands on the ground and squeeze your triceps in and under. So outer arms hugging in and under, and claw the ground with your hand. Inhale, float your hips up, your elbows are still on the ground. And then moving from your core, tip forward, move from your elbows to your hands, move forward to chaturanga. Then press back, keep your hips low, back to your elbows, and then back to your child's. That's 1. Inhale up to elbows, claw the ground, keep your elbows hugging narrow as you tip forward to chaturanga. Moving from your hands to your elbows and bum back to your heels for 2. Floating up to your elbows, keep your hips low. Glide forward onto your hands, tip forward, chaturanga, and moving from your hands to your elbows, back to your bum for 3. Inhale up, elbows, hands, glide, keeping it low. Exhale, back, hands, elbows, bum to your heels for 4. Last one. Inhale, elbows, hands, keep it low, glide, 5. Exhale, hands, elbows, bum to your heels for 5. And just take your child's pose. And then come up to tabletop. And then from here, you can take your legs wide. And then walk your hand over to the left. Turn your right palm up and drop down into your outer right armpit. Bend your left elbow. Your right palm is skyward. And then start to squeeze the right scapula in towards the spine. And then dome through the upper back. Pulling into the chest, knitting the ribs, pinning the navel, holding for 5. 4, press the back of the right hand down. 3, keep your right elbow locked. 2, 1. Exhale, dip down. From here, walk your hands to the other side. Turn the left palm up. Good. And exhale down. Press the left hand down, activating the stretch, strengthening your end range. And from here, squeeze the left elbow into the spine and then close the chest, doming the upper body, knitting ribs, pulling into the core for 5, 4, 3, 2, 1. Exhale, melt that armpit down, side armpit, and then slowly come back to a seat. Good. And from here, maybe just start to roll the shoulders back one by one. And let's take this into a dolphin. So this is a dolphin pose, preparation for pincha. We're not going to do pincha, but it's a fabulous pose in itself to strengthen your external rotators. So from here, we'll start with the hands together and take the elbows down to the mat. Lift your hips back, lengthening through the spine. We're not going to hold it too long for 5, 4, 3, 2, 1, and then slowly come down to your child's pose. And now we're going to do that again, and this time we're going to do it again in an external rotation. So again, working from the shoulders, strengthening the rotator cuff muscles. You can take a block and take your pinky finger, the base of your pinky finger, to the edge of your block, palm facing up. Good. Now from here, your elbows, make sure your elbows stay in, you don't want them wide. So keeping them in so your scapula can draw down the back. And really press the outer hands into your block firmly and lift your chest away from the ground, knitting your ribs, and then lift your hips up and back. Your heels can stay off the ground, helping you maintain the upward tilt of the pelvis. And you don't want to have your shoulders forward, so you're trying to press your elbows down and bring your shoulders back behind your elbows for 5, 4, 3, 2, 1, and then slowly come down onto your knees and then just release your head to the ground. Now you can stay in any of these poses for longer, or you can do more reps. Again, I just want to give you a guideline today and go through them just for about 5 breaths, just to give you an idea. And of course you can build your own classes and practices out of that. So we're going to do now a dolphin, like we did our dolphin here, but now we're going to do our dolphin with the palms down. We still want to keep the same shoulders, so the opening through the shoulders, but we're just going to turn the palms down. So you can again take a resistance band over your elbows, and this can really help. You keep your elbows in, and then you can take the L shape of your index finger and thumb around the corners of your blocks. So before you go up, I'd like you to squeeze your scapula together to help you open the front chest, and then knit your ribs in. Draw your elbows to the midline, lift your hips up and back. Weight the base of your index fingers. And again, notice if your shoulders are coming forward over your elbows or even beyond your elbows, and you want to get those shoulders back past your shoulders back towards your hips. And you're still knitting your ribs in. Again, this is great. I mean, this is like in Iyengar yoga, they used to use dolphin pose and pincha, like so balancing on this shape for things like whiplash, because it helps to, you can come down to your knees, it helps to create that balance through the glenohumeral joint, the rotator cuff muscles as they articulate with the rhomboids in the space between the shoulder blades, and we know from the rhomboids connect fascially up onto the occiput through the neck. And so it's really important to keep that, the muscle balance through there. Sometimes there's people who, they look good and they have the, the bicep and the toned arms, or they can lift so much weight or whatever, but they do have impingement, and they do have issues because of muscle imbalances. So just because, having, and I see this in yoga all the time. I actually had someone this weekend who, going to the gym and over strengthening her pecs and that to try and get into handstand. She's really trying to get her handstand. And actually she ended up tightening her lateral lats and pecs so much that she couldn't get her wrist over her shoulder because of the muscle tightness from the gym. So she created a muscle imbalance. So if you can't get your wrist over your shoulder, you definitely can't do a handstand, just because, you know, but so the muscle, too much tightness in the muscle was actually pulling her out of her yoga poses. And it wasn't slouching, it was gym, you know. So yeah, so it's to be careful. I'm not saying gyms aren't good, but it's just having the knowledge, making sure you're getting the balance between all sets of muscles, because so that you don't create a muscle imbalance and have the, you know, relating symptoms and issues. Okay, so from here, this is our hardcore piece of the class, and it's optional. You can use a block, you can use a block and a band, you can use a band no block, maybe I'll do band no block today. And this is our dolphin into planks, and again, it's optional. So the band makes it nice and easy, helps to keep the elbows in. Of course, you can do it no props at all, which I probably should do. I don't need a band, I'm just being a little bit lazy. So weaving in plank pose, and then clawing the ground and wrapping the triceps in and under, sending the eye of the elbow a little bit more forward towards the front of the mat. Now lift your hips up and back for downward dog. Now when you lift your hips back, your elbows will want to go wide. And I'd like you to squeeze them into the midline as much as you can, activating the inner arms, and then hover your elbows off the ground. This is called turbo dog. Then inhale up to plank, and exhale back to turbo dog, or hovering dolphin. Inhale to plank, exhale hovering dolphin. Inhale to plank, exhale back. Inhale up, exhale back. Inhale up, exhale back. So this is a hard pose, this hovering dolphin. You really have to work your arms and get that action, external rotation action, through the rotator cuff muscles as you activate the bicep. Inhale coming up, exhale to your knees. Bring your head to the ground and take your child's pose. And then coming up to a seat. So that is all our hard work done for the day. And after all of our hard work, we're going to go back and release the wrist flexors and extensors. Now, you can do this as a separate exercise as well. I'm doing them today. We've done some release already, but I'm doing them here at the end of the practice just because we've used these muscles so much to give them a nice counterbalancing. So yeah, so basically, let us start with the wrist flexor. Even though here we not only are working with the extensors when we turn the palm down, but we're working at grounding the inner wrist down, creating an internal rotation through the lower arm. And this, a lot of people find this very, very effective again for elbow issues because the muscle imbalances can start to actually move bones. As we know, this can happen. Okay, so I will do it from the front. So take your right elbow down and take your right hand in line with your right wrist. So yeah, we're going to do upwards first. And here, just take your left arm forward, walk your knees forward towards the forearm, and take your left knee into the center of your right forearm. And you can press down here and give it as much weight as you can. And you can just hold and breathe, or if you wish, you can wiggle your fingers. And then you can do another one, bring the knee closer up to the elbow and continue. You can go down a little bit towards the wrist if you feel a lot of tension there, but again, don't go onto the veins at the very back of the wrist. Okay, and then from here, turn your palm down. So as I say, when you turn your palm down, you might notice the inside of your wrist is still off the ground. And this is what I mean, where the tension can actually affect the structure of the bones. So if that is the case, you can take your left knee and place it on the inside of your wrist and compress the medial wrist down onto the ground. Take a couple of breaths. And then from here you can walk your left knee closer up, just about 2 inches, and it's like you're rolling the front of the forearm towards you as you press the medial compartment of the forearm down with your left knee. And then we'll do one more. Move your right hand to the right and take your left knee closer up to the elbow now, and turn your rotating the forearm as you press the knee down. And then come back up. So starting now with your left elbow, you can start in the middle of the forearm, the right knee pressing down. If you wish, you can wiggle your fingers. Take it closer up to the elbow. Good, and then turn it down again. So just walk your knees back and just look now at the shape of your arm and your wrist. As you place your wrist in line with your shoulders, your right wrist lifting off the ground, and you can gently press it down with your right knee. Walk your hands an inch or two forward, press the knee down out into the center of the forearm. Walk your hand an inch or two forward, go closer up to the elbow, and again turn your rotating form as you drag the skin and fascia beneath towards you. Breathing deep. And then slowly releasing. Good. And coming to a seat. So just making a few arm and elbow movements. Feeling into your arms, your shoulders, how your shoulders and wrists articulate through the elbow. And I think you probably, like myself during the class, would have also felt some of those adjustments from the hand and the forearm, even moving up into the neck as well. So of course we know of the referral pattern here, not just through the median ulnar and radial nerves, but also through the fascia. I hope you have enjoyed this class. Please take a rest. It was a fairly strong class, so take a rest if you need, and I look forward to the next class. Namaste.